Chuck Hagel were all on the phone with Al-Sisi on the evening before the coup, yelling at him, being very stern. You will not do this. Do not do this. And he went ahead and did it anyway.
John Batchelor, tonight at 9 on 77 WABC. 77 WABC.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. This is Dr. Gil Lederman, live from ABC Studios in the heart of New York City. I'm here with John Taransky, who's riding co-pilot today.
That's it. Good morning, Doctor. How are you?
Fine, thank God. How are you?
Outstanding.
We're here to talk a lot about new issues in oncology, news. We're here to answer your questions. You're welcome to call us in at the WABC Studios at 1-800-848-9222. Again, 1-800-848-9222. We're here to interview experts in the field, answer your questions, and bring news, and also to discuss interesting cases of the week, cases that patients that I've seen over the week that have some reason to discuss, or interesting points, or things we can all learn from. So I hope everyone's having a good day, and I hope we have a great time on the show this morning. First thing I want to talk about is how to save lives. And obviously, as an oncologist, we want to save lives. The best thing is a person who never gets cancer or who's diagnosed at an early stage so that the cancer can be treated and the patient lives a normal life. So last week we talked about cervix cancer and saving tens of thousands of lives with simple testing.
What was it, 10 cents, Doctor?
Yeah, it was doing special stains on the cervix using vinegar,
right,
identifying lesions of the cervix, and identifying, especially in low-income countries where access to health care isn't so prevalent, the ability to find the cervix cancer early and treat the patient before the cancer spreads and causes harm. So similarly, there's another study out, brand new study, that looks at lung cancer and early screening. This kind of work has been going on for probably now a decade, and there's a new report out. So for patients who are really for people who are smokers or ex-smokers, even though you're an ex-smoker, 10 years out from smoking, there's still a significant risk, more than double of the normal population, of developing lung cancer. So the question is really how to find the lung cancer when it's early, treatable, and most likely curable. And the most recent study was presented at ASCO, which is a National Society of Oncologists, or cancer doctors. And doctors looked at screening with CAT scans versus chest x-rays. So chest x-ray is an old-style way of looking at the chest, the lungs, the heart, the mediastinum. The mediastinum is a tissue between the right and left lung. Did you know it? Did you ever hear that word before, John?
No, I can't say that I have, Doctor.
So it's a big part of our body. The mediastinum has
sure.
a lot of stuff in it. It has the heart, the esophagus, lymph nodes, the airway. So it's a big part of our body, but it's not so sexy, so people don't talk about it very much. We don't talk about Angelina Jolie's mediastinum.
Right,
but we're going to talk about her breasts later in the program if we have time. So there's a way of doing CAT scans. CAT scans are images of planes of the chest. Rather than to see the whole chest on one piece of X-ray film or one view, you can get dozens or more views of the lung, so there's finer cuts. And it's estimated that if you do low-dose CAT scans of the chest in patients or people who were smokers or ex-smokers, you can actually reduce lung cancer deaths by about 12,000 a year in America.
Wow.
So you're talking about, again, huge numbers of people affected if they only would go about this testing.
Sure.
The testing is easy. It's non-contrast, so there's no injections. The scan probably takes 2 or 3 minutes. It's very fast. And you then see if you have any nodules or anything that brings attention to further care. If there's nothing there, you can get a scan the next year. The first scan picks up the most patients because you're getting all the new information for that patient for all their life, pretty much. And then the annual scans just pick up the difference, what's happened since the last scan.
Now, doctor, let me ask you a question. How often should a patient, have a CAT scan?
Well, there's a bit of a problem, and some of the insurances will not pay for screening CAT scans. So a lot of the health insurance will pay for taking care of you if you're sick, but they may not pay for you if you're not sick. And so probably in smokers or ex-smokers, probably annually, and then based upon that, a certain regularity. The most invasive cancers, biggest cancers, are picked up with the first screening. So I would really urge people who are smokers to stop, of course, and if that's possible. And for people who are ex-smokers to try to do something about their health to try to make up for lost time. Right. So that's an interesting study from ASCO. And in a similar vein, the United States government just reported on longevity, how long people live. Right. So I don't know, did you hear about that this week?
I didn't hear about it, but I do know a little bit about that word. So this conversation I can shed some light on.
Okay, so tell me, what do you know about longevity?
Well, the amount of time you live. Is that correct? Or?
Yeah, that's right.
Yeah, so everybody varies, obviously, due to their health.
So let's say your great-grandfather was born 115 years ago, something like that. Is that fair to say?
Sure.
So my great-grandfather was born in 1888 in Eastern Europe and came to America. So someone who came to America, was in America in 1900, how long did they live?
A lot less time than we do now.
That's right.
Yeah.
So about 50 years.
50, okay.
And there's a new study out from the United States government that actually is analyzing that information and looks at whites versus blacks. So for other groups, it doesn't talk about it. I'll try to get that information for you. But the gap between the life expectation of whites and blacks is getting narrower and narrower, which would suggest that people are getting better health care. And actually, the gap is improving more, longevity is improving more for black people than white people, even though white people have a greater longevity. So in the 1930s, the difference was pretty large between blacks and whites. Most of the differences are because of heart disease, cancer, homicide, diabetes, and infant mortality. And those diseases accounted for half the disadvantage in blacks in 2010. So again, heart disease, cancer, homicide, diabetes, and infant mortality. And this was reported by the National Center for Health Statistics, which is a federal agency. And black people had made the greatest gains. So life expectation, how long you're going to live, was up since 1970. So that's probably a little before you were born. It was after I was born. But for blacks, they actually had an improvement of 17% in life expectation from 1970 compared to 11% in white people. Why is that? What would you think?
Does it lead back to the healthcare issue?
100%.
Okay.
So there's less AIDS going on now. There's less homicide. For example, New York now is the safest it's been, and many large cities are much safer.
I would have to also say with the issue of homicide, it must be in specific regions or geographics must play a role in that.
Right. So when you have the homicide rate falling, I think New York is the lowest rate in history.
Yeah.
Recorded history. So it's obviously letting people live longer. Blacks still have higher rates of heart disease, but they're benefiting increasingly from treatment. So life expectation for black people was 75 years in 2010.